the subject of our conference is very interesting for you. It is currently trending in the fields of neurosurgery and in the fields of physics. This is why we chose the subjects. So I wanted to show you that we have a possibility of the collaboration between the physician and doctors. This is the objectives of our conference. So the career development in the fields of neurosurgery introduced the physician and the physician, especially the physician equation. So we have in our conference two parts. In the first part, I want to show you what is the aneurysm, the characteristic of intracranial aneurysm, and the some aspect of this intracranial aneurysm. And in the second part, my colleague will show you the characteristic, the physical characteristic of this intracranial aneurysm. She show you the application of the physical sciences in the medical practice. This is the objective of our conference. So the title of my conference is The New Methods for Controlling the Cerebral Aneurysm, the Finite Volume Simulation of the Blood Flow. This is the title of our conference. So our objective, I said before, is the application of the physical science in the medical practice. This is our objective. You see this slide? Yes. Okay. As you know, the vascular disease as arteriosclerosis and aneurysm make increasing or interesting fluid dynamic and hemodynamic effects. However, most study focuses on the blood flow through the stenosed vessel. However, we have limited information about the blood flow in the expanded vessels. This is why we choose this topic. Because we have limited information of the effect of the blood flow on expanded vessel. So what is the aneurysm? The aneurysm is characterized by the dilation of the vessel wall. This is the definition of the aneurysm as a pathology. And this is the production of the classical phenotype of this pathology. We noticed that the development of intracranial aneurysm is often related to some particularity of the intracranial vessels. So we know what are the particularity of intracranial vessels. The intracranial vessels have three layers. The first one is named adventitia, and it is composed of connective tissue, nutrient vessels, and autonomic nerves. The second one is a middle layer or a muscular layer. It is composed of small muscle cells and elastic tissue. The last one, the inner layer, is endothelium. It has one property, anti-atherogenic property, and these properties inhibit the platelet aggregation. So you pose question, why you are showing this a particularity of intracranial vessels? The answer is because in the second part of our conference, we show to you that the ruptured aneurysm is characterized by the no small muscle cells, or we have less small muscle cells. So you must learn that this small muscle cells is located in the muscular layer, in the middle layer of the vessel. The intracranial vessel presents some particularity. We have a curves and bifurcation. These two particularities lead to the emergence of this pathology, the aneurysm. So we can say that the formation of aneurysm is a complex process. Why this? Because it involves a different or a number of factors. We have the biological factor, the physical factor, and external factor. All these factors are associated with a genetic predisposition. The size and location in anterior or posterior circulation is considered as a classical risk factor. However, in the last decade, we have the introduction of hemodynamic factors. We introduced the hemodynamic factor in order to improve the rupture prediction. This is our objective. So the hemodynamic and the blood flow in the case of cerebral aneurysm pathogenesis have drawn great attention recently. And also, we have recently the intervention of the technology. We use the computational simulation of blood flow and aneurysm. And we use this thanks to the development of the computer software. Now we pass to the biological and hemodynamic aspect of aneurysm. As you know, the brain receives 20% of circulating blood volume through 4 cervical vessels. We have carotid and vertebral artery. This is 4 cervical vessels that gave the blood volume to the brain. And in our brain, we have one circle named circle of Willis. The circle of Willis is composed of 4 arteries. We have the anterior cerebral arteries, the posterior cerebral arteries, the posterior communicating arteries, and the basilar arteries. This is the composition of this circle of Willis. And look here, we have some particularity. We have the curves, 2 curves, and also some bifurcation. This bifurcation and curves at the level of the circle of Willis create a peculiar development of the blood flow, and it leads to the emergence of some aneurysm. We pose one question. A ruptured aneurysm the same entity, or we are dealing with the 2 different processes? So what is the difference between the 2 kinds of aneurysm? In this case, there is the intervention of histology. Histologically, the ruptured and unruptured aneurysm are different. In the case of ruptured aneurysm, the small lesion, in this case, as I said before, we have less or no collagen and a small muscle cell. While in the case of ruptured small lesion, here the aneurysm contains a dense collagen and smooth muscle cell. This is the difference between the 2 kinds of aneurysm, ruptured and unruptured aneurysm. We have some factors that distinguish between these 2 kinds of aneurysm, and these factors are cellularization, apoptosis, degeneration of the wall matrix, thrombus organization, proliferation, and inflammatory infiltration. This is the factor that have influence on the rupture of aneurysm. Now we pass to the genetic aspect of the aneurysm. Here we have the intervention of this marker gene. We have a smooth muscle cell marker gene. In the normal condition of the cerebral blood vessel, here we have an increased expression of this marker gene. However, in the case of aneurysmal formation, this expression decreases, and it leads to the apoptosis of a smooth muscle cell. So we have the loss of this smooth muscle cell, And as a consequence, we have the rupture of this aneurysm. So you must know that the difference between a rupture and a rupture muscle cell is the loss of the small muscle cell, and the cause of this lossing is the decrease of the expression of the marker gene. This is the difference between the takings of aneurysm, ruptured and ruptured aneurysm. The biology of the aneurysm formation is a complex process that will be a result of indigenous predisposition, as we see in the last slide, and also epigenetic factor. And also we have the inclusion of hemodynamic forces, hemodynamic properties. And as you know, the hemodynamic is the study of the blood flow and also the physical forces involved in circulatory system. This is the definition of hemodynamics. It is the study of the blood flow and also the physical forces involved in circulatory system. In this cerebral aneurysm, we have hemodynamic forces. These hemodynamic forces is created by blood flow. Okay, so here we have hemodynamic shear stress. This blood flow create hemodynamic shear stress. So we can say that the physiology of aneurysm is closely related to the local hemodynamic stress. So the blood flows create hemodynamic shear stress, and then we have the progression of this aneurysm to the rupture phase. Now we pass to the flow parameter of aneurysm. The flow parameter include how the blood moves, how the arterial walls behave, and whether or not they have not Newtonian effects. They also affect the size and location of the hemodynamic stresses. This is the parameter of the flow, blood flow in the case of aneurysm. This blood flow create or apply a tangential forces to the vessel wall. So the tangential forces applied to the vessel wall by the blood is a caded wall shear stress. And this wall shear stress influences the endothelial cells, and it has a great role in the emergence of vascular disease. So the causes of the emergence of vascular disease is the wall shear stress. And this wall shear stress is created by the blood flow in the vessel. We noticed that the high level of this wall shear stress are prerequisites for the initiation of intracranial aneurysm. But the implication of this wall shear stress in the growth and the rupture of this aneurysm is still unknown. So we must have a study on the effect of this high level of wall shear stress on the growth and the rupture of the case of aneurysm. The shear stress have been shown to actively influence the vessel wall remodeling, and this remodeling is proportional to the velocity gradient at the wall, and also it is proportional to the fluid viscosity. The progression and the rupture of this aneurysm have been associated with the zone of the aneurysm wall exposed to some characteristic. So it is exposed both to the high and the low shear stress. And our objective of study, our conference, our project is to know what are the zones of the rupture. So according to the literature, the zone is located in aneurysm mode, which is exposed on the high and low shear stress. So when we have zone exposed to high shear stress or low shear stress, we have a risk of the rupture of this aneurysm. And my colleague will present to you some characteristics of this high and low shear stress. And she presents to you some equation, the Navier-Stokes equation. The interaction between the circulation and the vessel wall is governed by one law named a Poisson law. This law describes the laminar displacement of viscous fluid in the pipe. And in the case of our study, we have some hemodynamic issue. The hemodynamic issue are the circadian variation and also the chronic condition. The circadian variation as a systolic and diastolic cycle, and this chronic condition like hypertension. All this condition increase the complexity of evaluation of intracranial hemodynamic. This is the hemodynamic issue. Now we pass to the technology applied on the medical practice. The field of mechanical engineering and molecular biology both have a great role in the study of the role of hemodynamics in the physiopathology of intracranial aneurysm. The computational flow dynamic, which is used a lot of in engineering and industry, started to be used in order to evaluate the intracranial vessel and also intracranial aneurysm. And this is in order to solve some problems. This computational flow dynamic is helping to understand the intracranial flow, but the relationship between with aneurysm formation or growth is still to be proven. You pose a question, why you use this computational flow dynamic? We use this in order to give some information about wall shear stress, the quantity of this stress, and also its distribution in aneurysm. And this computational CFD gave another information. It can give many information about a dynamic parameters like oscillating shear index. This index gave you the information of how much the aneurysm wall is being stressed and also how much the aneurysm wall is worn down. Also, this CFD give you information about velocity fields. This velocity field could be calculated and showed as a vector path or streamline. And also, it could be used to judge the flow behavior qualitatively. So, this CFD give you information about wall shear stress, about oscillating shear factor index, and also velocity fields. So we can say that this CFD play a great role in giving information about fluid dynamic related parameters. This is the graphic representation of CFD. And look here, this is the aneurysm. The aneurysm is located in B bifurcation. And the colors here represent the values in the range from the lowest in the blue, presented by the blue, to the highest, presented by the red. This is the graphic representation of CFD. As I say, this CFD give you some information about fluid dynamic related parameters. The CFD consists of simulation method, which is based on some equation. These equations are named Navier-Stokes equations. And this equation model the blood flow through a patient-specific vascular geometry and they usually generate from a patient imaging data. So, in the second part of our conference, my colleague present to you the composition of this equation and its role in dealing of the aneurysm. Now we pass to literature review. Fortunately, it has been established that we have a progression in the study of aneurysm. The beginning with a biological and hemodynamic aspect of aneurysm, progressing to the modeling, a numerical model of this pathology, and flowing by the effect of certain biological parameters like hematocrit in the management and the treatment of aneurysm. So the objective of this first part is to give you a general idea of what is aneurysm, what is the characteristic of intracranial aneurysm, then the introduction of the physical and computational science in the field of a medical practice. And now we pass to the second part of our conference. We deal with.
Hi everybody. I am physician in Algiers. Yes, doctor of physics. I will introduce now the second party of conference and presented my study of aneurysm. One of the preferred cities of intracranial aneurysm is the anterior communicating is the anterior communicating artery to 30 to 37%. It is an anastomotic artery connecting to two anterior cerebral arteries in front of the chiasma. It participates in the constitution of the arterial circle of the brain. It provides anterior medial central arteries, suprachiasmatic artery, median commissural artery, median callous artery. This is the mathematical model. Blood flow is considered in anterior communicating artery of length L and radius R. Delta is the maximal swelling of the aneurysm. The geometrical parameters are usually used to determine the category of characteristic of aneurysm for making treatment decisions. This parameter includes aneurysm size, aspect ratio, and vessel curvature. Study area are before, after aneurysm, and the region of aneurysm. These parameters include aneurysm size, aspect ratio, and vessel curvature. In order to model this pathology, we will use the Navier-Stokes equation in the direction R, theta, and Z, the equation of continuity, and this by applying the following assumption. Regime permanent, delta out of delta t equals 0, flow along the axis of revolution Z, velocity r equal velocity theta equal 0, and velocity z not equal 0. Symmetry with respect to the axis, so we have no affluences according to theta. The flow is axisymmetric, delta out of delta theta equal 0. The anterior communicating artery is horizontal with a small diameter, so following all direction, rho J equal 0. We also apply approximation such as cylindrical, the anterior communicating artery, so the blood flow is everywhere parallel to the wall. Lubrification approximation. Friction of at the wall, no slip condition, apply that the speed is zero, velocity is zero. The pressure does not vary, lubrification approximation. The velocity is parallel to the axis of the anterior communication artery, Z. Velocity in direction on the vector UZ. We will introduce Young's relationship for stenosis, but we have modified it for aneurysm. It is the equation for the radius of aneurysm. In order to calculate the radius of aneurysm as a function of a position, and this for different possible deformation with delta mathematical equal delta Now let's move on the formula of speed. This is a formula of velocity with the position, and A is the difference of pressure with the position that will allow us to have the pressure at the level of the aneurysm according to the deformation on the artery and the pressure of the patient. This graph tells us that the position of the aneurysm does not depend on the delta clinic, also that the value of the maximum radius coincides well with delta clinical. This graph tells us that the pressure is minimal as Z out of L0 equal 1/5. Therefore, Z in the position equal 2 millimeter and the radius equal 1/005 millimeter. And the pressure are constant during aneurysm, which confirm the hypothesis. In conclusion, this work will lead us to early detection of intracranial aneurysm just with the radius and the position of aneurysm. In the future, we want to extend our study to determine the type of region, laminar or turbulent, and the wall contentment. The region laminar or turbulent use the number of Reynolds for this today. Thank you for your attention.
Thank you, Assia. So the objective of this second part of our conference is to give you a mathematical model of the aneurysm. She showed to you the influence of some parameters. She changed the cylindrical form of the aneurysm, and she chose exactly the anterior communicating artery, because we have it is the best location of the aneurysm. It's more frequent in this place, and this anterior communicating artery has a horizontal position, and she used some parameters cylindrical in order to now the exercise of the forces when we have blood flow parallel to the wall. So what is the influence of this parallel position of the blood flow on the wall? Is there changes in the wall vessel or not? So this is the first part of her research project. This is the first part. And we continue our study in order to show other parameters that influence the position and the location of the aneurysm. So, as I said in my first part, the location and the size, location in the anterior and the posterior circulation with the size are considered as a classical risk factors. Now we pass to the study of the hemodynamic forces on the wall vessel, and she applied a mathematical model. As I said before in my first part, she will present to you the composition of a nerve stroke equation. So she shows to you the composition of this equation and the role of this equation in the controlling of the aneurysm position, forces, shear stress. This is the first part of her research project. And we will continue, inshallah, in the future with another study. Yeah. It's a general summarize. Our objective is to show you that we can work together, the physician and the doctor. This is a best example of the career development, the collaboration between two different fields, a physician and a neurosurgeon. If you have any question, you can write your question in the part of the discussion and we will answer. No problem. Okay, yeah, smoking and smoking alcohol could cause aneurysm. It's not cause the aneurysm, but it is considered as risk factors. So you can pose a question: what is the mechanism? What is the action of the smoking on the aneurysm? And the answer is: the smoking and alcohol participate in the modulation of small cell marker genes. So this smoking increases the expression of the smooth muscle cells gene, and as a consequence, we have a loss of muscle cells. And so when we have a loss of muscle cells in the aneurysm, we will have a rupture of this aneurysm. So the smoking and alcohol participate in the rupture of aneurysm by the mechanism of decreasing of the expression of the marker gene of the smooth muscle cell. This is the mechanism of action of smoking on the aneurysm emergence and rupture.
Yeah, first of all, thank you for the presentation, Dr. Habchi. I do just wonder how you show the aneurysm in human. What kind of radiology, I mean, BT, MRI used in human to show aneurysm?
In my first part, I showed to you what is the aneurysm, and for the treatment, we have two kinds of treatment. We have the coaling and we have the surgery. Your question is about what?
I mean, how to define the aneurysm in the brain? What kind of imaging methodology you use to show it in human?
Okay.
BT, MRI.
We have angioscan, angiotidium. Angiography and angiotidium is specific for the piston, the kinds of aneurysm. This is the level of knowing the kinds and the position of the aneurysm, the size and location. So
Thank you.
this is the tool in order to know if you have aneurysm or not. Angiotedium.
Thank you
It
so
is
much.
more specific. It is more specific than angioemeral. Okay? And
Yeah,
more
okay.
practical. Okay?